extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear, on 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear, on 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov.
from the 11 Alive studios, our special coronavirus coverage, Facts Not Fear, starts now.
Good afternoon. I'm Francesca Amaker. Let's get to the latest coronavirus headlines at this hour. Fulton County shutting down 5 health centers amid a global pandemic. Why officials say they made the decision. Plus, the CDC considering new guidelines for people exposed to the virus, but don't show symptoms when the new suggestions would allow for some to return to work. Plus, examining the effect of COVID-19 on African American communities. The growing push for a breakdown of cases by race. But we begin with the latest coronavirus numbers here in Georgia. Take a look at your screen. The Department of Public Health just updating them just moments ago. There are now 362 deaths, 9,881 confirmed cases, and 1,979 people hospitalized. Fulton County now has more than 1,200 cases. Startling numbers. Also new at noon, Governor Brian Kemp is extending Georgia's public health state of emergency to May 13th. The original order was set to expire on Monday. The change now allows resources to continue to be deployed to communities in need. And we want to be clear, the state of emergency is not the same thing as the statewide shelter-in-place order. The shelter-in-place orders is the one that restricts who is allowed to work right now and who's not, among other things. As of right now, that order is still set to last through Monday, April 13th, and we expect the governor to address both during a news conference this afternoon at 4. We'll carry it live on air and on our 11 Alive YouTube page. And we'll have more on the coronavirus in a moment. But first, and right now, we want to check in with meteorologist Chesley Mcneil, who's tracking the potential for some storms heading our way. Chesley, so good to see you.
Good to see you, Francesca. Yeah, back together, but not together. We're in separate areas,
right,
but close enough.
Social
close
distancing.
Enough. Absolutely. All right. Thanks a lot. Folks, if you walk outside right now, maybe go out to your porch, it has the feel of rain. In fact, when you look outside, you'll see mostly cloudy skies out there. Feels a little bit thick, feels a little bit humid, right? As if it could rain at any minute. Well, it can. We do have a few isolated showers out right now. If you want to get the kids out, you definitely need to take them out now, because later on we'll expect to see more of these showers beginning to pop up in the area, and some of those will have some embedded thunderstorms, which could be on the strong to severe side. We're tracking a system just now getting underway. You see the severe thunderstorm warnings associated with it, a wave that's going to move through and bring us a threat for severe weather. There are 2 rounds. We'll get one later this afternoon after about 5 or 6 o'clock, and then a front coming down will bring or keep the chance for the thunderstorms in the forecast through the wee hours of the morning. Notice this right here, an enhanced risk for severe weather. That's this tan shaded area. That's a 3 out of a possible 5. And then the yellow, which extends into our state, much of it now has been extended further down to the south by the Storm Prediction Center. That yellow means slight risk for severe weather. That's a level 2 out of 5, which means isolated tornadoes are even possible with some of those thunderstorms that roll through the area. The main threat would be those damaging winds, some frequent lightning, heavy rain, and maybe even hail. Let me time it out for you hour by hour real quickly here, and you'll see that we'll even get a break in some of those clouds as we head through the afternoon. Here we are by 5 o'clock, 5:15 to be exact, and you can see some of those showers and thunderstorms starting to cross the border. Now, our model puts a lot of that down into the central and southern portions of the state. We'll see some embedded thunderstorms around here. The second round comes as we head into the wee hours of the morning. So here we are by 4 o'clock in the morning. That front making its way toward us will bring in another round of showers and thunderstorms rolling right on through the area, which will bring some thunderstorms, which will pack some gusty winds. Should be out of the area by tomorrow mid-morning, and we'll get the sunshine back in. In fact, we'll hold on to that as we head into Good Friday. So here's your 5-day outlook. It shows today up to 81 degrees for the high. The chance for thunderstorms this afternoon, 76 tomorrow. The rain will end early, and then we'll clear it out and have a good start to the weekend, and then more rain comes back to us by Easter Sunday.
All right, Chesley, I'll take 9 and 10 any day, Friday and Saturday, folks. All right, Chesley, thank you. Breaking now, Senator Bernie Sanders has dropped out of the presidential race. With the coronavirus outbreak, it's hard to remember it also is an election year. And today, Sanders, once the Democratic frontrunner, officially ended his campaign, broadcasting a special message to supporters on social media. His departure leaves former Vice President Joe Biden as the likely Democratic challenger to take on President Donald Trump in November. Now, we have more about the state of the 2020 election on 11alive.com. Fulton County continues leading the state in the number of COVID-19 cases. In an effort to stop the spread, the county is now shutting down a handful of health clinics to the public. Nick Sturdivant is in Atlanta with more.
I'm standing outside a Neighborhood Union Health Center on Sunset Avenue here in Atlanta. Just one of several health clinics here in Fulton County that are now closed to the public. Take a look at your screen. Here's the list of clinics across Fulton County that are now closed to the public. Adamsville Regional Health Center, Center for Health and Rehabilitation, North Fulton Service Center, again, Neighborhood Union Health Center, and Oak Hill Child, Adolescent, and Family Health Center. The reason? Well, the Fulton County Board of Health told me this morning that it has put this in place to reduce the spread of COVID-19 and to protect the health and safety of its clients and staff. They also told me that clients looking for help at the county's other locations will be required to have their temperatures checked and wear masks before they are allowed to enter the building. This also applies to the people that work there. Also, the Board of Health says anyone who has COVID-19 symptoms will not be allowed into the building. Nurses will check temperatures and provide masks as people come in. And I'm also told if you refuse to wear a mask or get your temperature taken, that you will not be allowed in the facility.
Nick, thank you. And possible new guidelines on returning to work if you test positive for the virus. The CDC is considering changing its recommendation on self-isolation for those who are asymptomatic. Now, under the proposed guidance, people who are exposed to the virus would be allowed back on the job if they test their temperature twice a day and wear a face mask. The action would be aimed at workers in critical jobs. An announcement could come as soon as today. And coming up, we are taking your coronavirus questions straight to the experts. If you have a question for 11 Alive medical correspondent Dr. Sujatha Reddy, we want you to text us, the number on your screen right there, 404-885-7600. And remember, text, don't call, and please include your name and where you are from. And today we are learning more about a disturbing reality of this pandemic. Coronavirus is actually affecting African Americans at a disproportionate rate, accounting for more cases and more deaths. NBC's Blaine Alexander in Atlanta with more.
Well, Francesca, hello to you. You know, the coronavirus does not discriminate, but there are a number of factors that do, including income, access to health care and information. So now there's a growing call for the CDC to track coronavirus cases by race and release those numbers. As coronavirus tears an unforgiving path across the country, numbers show it is especially devastating to one group, African Americans. In Chicago, nearly 70% of virus-related fatalities are black, even though African Americans make up less than a third of the population.
It's stunning. It is a red alarm, an alert that we've got to respond to.
In the epicenter, New York City, 59% of deaths are in Queens and the Bronx, both areas with high black and Hispanic populations.
We're working very hard on the African American community with respect to what's going on because it's not good. I don't like it.
Down south in Louisiana, African Americans, who only account for 32% of the population, make up 70% of the state's deaths.
Those hotspots are in areas of the state that have a disproportionate number of African Americans living there.
Not every state reports cases with a breakdown by race. The White House task force says the federal government is now collecting that data.
It will be public as soon as you get enough data to be able to make a meaningful statement.
Why is the black community getting hit so hard by this?
Well, the black community has been hit by poor health for a long time. Now you compound it by this deadly disease. I mean, it's no surprise that we're going to get hit harder.
Especially hard in smaller communities like Albany, Georgia. In a county nearly 70% African American, it has more deaths than anywhere in the state. Terica Parks is a survivor.
So I was wrapped in the blanket. I'm laying there gasping for air, and all I'm thinking is, I don't think I'm going to make it.
People are scared. We're scared. We've never seen anything like this before.
And in addition to those underlying conditions, there is another factor. A higher number of African Americans have jobs that require them to work during this pandemic. So positions like janitors or bus drivers or grocery store clerks, where sheltering in place is not an option. In Atlanta, I'm Blaine Alexander. Back to you.
Startling numbers, Blaine, thank you. 10 seniors at the same Athens nursing home have died after initially testing positive. Pruitt Health tells 11 Alive the patients at the Grandview nursing home died within the last few weeks, but it can't confirm the exact causes of the death for each of them. A presumptive positive test result means that the CDC still has to officially verify it. And the Georgia National Guard has deployed more than 100 troops to nursing homes across the state affected by COVID-19. The troops Troops are helping sanitize facilities to prevent exposure to seniors. And there are continued calls for the Beltline to be shut down this afternoon, despite new guidelines from Mayor Keisha Lance Bottoms. Now, the mayor releasing these new rules right there on your screen, saying timing is everything. 6 to 10 a.m. is now reserved for older adults. 10 a.m. to 2 p.m. is for daily exercise. And after 2 p.m. is reserved for work and emergency-related travel.
The information that I am receiving and then running past our public health professionals is that right now we are not at the point that we need to close down our parks and Beltline.
An online petition has more than 10,000 signatures urging leaders to close the popular trail. And protective equipment help coming from the University of Georgia. The first batch of medical face shields produced on campus have been delivered to local medical professionals. Throughout this pandemic, protective equipment has been hard to come by. The school plans to deliver 200 face shields to 2 Athens area hospitals by Friday. And Delta is still finding a way to connect people, not through flights, but through food. Yeah, the Atlanta-based airline is sending 200,000 pounds of unused food to places like hospitals, food banks, and others around the world as frontline workers press on amid the COVID-19 crisis. And the food was left over after Delta adjusted service, and the food would have expired. And here in Atlanta, Delta said it is also working to provide trays and supplies to hospitality workers and first responders at Emory University Hospital. Still ahead, folks, a groundbreaking new type of test for coronavirus, and it's being produced right here in Metro Atlanta. Plus, 11 Alive medical correspondent Dr. Sujatha Reddy is answering your coronavirus questions live right here on the show. Let us know if you have a question by texting us at the number on your screen. It's 404-885-7600. And remember, text, do not call.
Questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Prime Time, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message.
Welcome back. Here's another look at the latest numbers from Georgia's Department of Health. But we begin with the latest coronavirus numbers right here in Georgia. The Department of Public Health just updating them just moments ago. There they go. 9,881 confirmed cases and 1,979 people have been hospitalized. 362 have died. And as the country struggles to ramp up coronavirus testing, an Atlanta company says it's working on distributing a groundbreaking COVID-19 test. BioIG says the saliva-based tests are rolling out nationwide this week. They're available to healthcare workers first, then they'll be available for essential workers and people who are at the highest risk for the virus. The company CEO says the aim is to get results back within 24 to 48 hours. He also says because of how the test is conducted, it can help save personal protection equipment like masks. And as we learn more about new tests like these, we know you have a lot of questions about the information you're seeing and hearing. So 11 Alive medical correspondent Dr. Sujatha Reddy is here offering the facts and helping dispel fears about COVID-19. We want you to send us your questions right now. It's 404-885-7600. Dr. Sujatha Reddy, how are you?
I'm well, Fran. You doing okay?
I'm really well. I'm trying to stay at ease, but we want you to ease our viewers because they have so many questions, and these are fantastic questions. So let's start with viewer number one. One of our viewers actually texted, if you get it and have a mild case, will your lungs heal without any treatment?
Yeah, good question. The good news there is if you get a mild case, you're probably not getting the pneumonia or the lung infection that's putting people in the hospital. So yes, your lungs should be just as good as they were before you got coronavirus.
Wonderful. And another viewer asked us, they say, I heard that menthol cream or Vicks on your nostrils can actually prevent the virus from passing. Any truth to that?
Yeah, no, I wouldn't count on that. You know, I think the best way to keep the virus out of your nose is going to be a mask and or the social distancing that we're talking about. So yeah, I wish Vicks was a simple treatment or a prevention, but it's not.
And Elizabeth shared there's a lot of misinformation about taking Advil if you have COVID-19. Doctors say there's no evidence to support this, but until there's proof, is it better to just avoid it?
I think if you have any doubt in your mind and you're a person that's able to take acetaminophen or Tylenol if you get a fever or an ache or pain, I think that would be better. But really, there is no scientific data. One thing I have to say is that for older patients, very often they're on some sort of aspirin therapy. Both my parents are either a baby aspirin or regular aspirin, and those people should not be taking Advil. So again, we just got to be cautious. Just because something's over the counter doesn't mean it doesn't have any risk.
And Haley's asking a question that many people want to know. How long will it take to show a positive test result after contracting the virus, and how long before you're contagious?
Yeah, great question. So the virus, once it's in your nose or in your throat, if you have it, it's going to be there. The tests that are being done, the swabs that we've seen go into the nose, are looking for pieces of virus. So those will turn up positive very quickly after someone has contracted the virus. As far as when you're contagious, that is the reason that things are changing for us as far as wearing masks, because we're now saying people have probably transmitted this virus or infected other people before they had symptoms. So you are contagious if you have COVID-19 before you have any symptoms. And, to clarify, I would think that if you contract the virus, a test is going to be positive within a few days.
And another viewer texts us this question, and this is one of my questions as well. Can we drive to the park to exercise, and can we just drive around to get kids out of the house?
Yes, I think if you're with the group of people that you're living with, you're already exposed to those people, and you want to get in the car and go for a drive, you can, except for with the shelter-in-place order, it's recommended you not do that. So if you live in a place where you don't have a shelter-in-place or once ours expires, I think it's perfectly safe to go for a drive in the car. But right now, I don't believe that that's legal.
Quick question for you, Dr. Reddy. Do you have any information on patients having high, I believe it's troponin, where the virus has actually attacked the heart, causing the patient to complain of heart attack symptoms?
So I believe you're saying troponin, and there are a lot of markers that we're looking at. I was talking to a friend of mine who's actually in New York City who's taking care of patients that have COVID-19, and the number of markers that are being looked at if someone's actively infected are incredible. That we're learning new things all the time, but there are some markers that are giving people an idea of how severe the infection could be. And yes, heart enzymes is something that people are looking at.
And one of our viewers, Helen, asks, could coronavirus cause the inflammatory disease sarcoidosis to flare up?
So another really good question. I don't think the coronavirus is going to aggravate sarcoidosis, meaning it's not going to trigger a flare. However, if someone gets coronavirus, you may get symptoms that may be similar to sarcoidosis. Or if you get an illness, they may recommend you stop taking, let's say, steroids for your sarcoid. So a lot of times health conditions are, interrelated, but a viral infection like coronavirus, in my opinion, should not trigger sarcoidosis to flare.
These are some great questions, folks, and keep them coming for us at that number. We will be right back with Dr. Reddy. Thank you, Dr. Reddy.
Cut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside?
Welcome back to the show, folks. Facts, not fear. And we've been talking to Dr. Sujatha Reddy, who have been answering your wonderful, in-depth questions. Doctor, we have a few more for you. This one coming to us from Carrie, and she's asking, how often should we change the hand towels that our families are using to wash our hands 50 times a day?
That's a really good question. And I think that, the more often you change it, the better. There's no concrete data, especially if we're all staying home and everyone's healthy. You probably can do your normal, but I think we're also on edge with this thing that probably changing them more frequently isn't going to hurt anything.
And Nate wants to know, we're all wearing these masks, but can our body fluids go through the mask and get on other people?
So, another really good question. And I think as far as body fluid, I think it's important to talk about, what we're saying here. So we know the infection is transmitted by droplets, by coughing, sneezing, even exhaling. If there's any spittle or spit coming out, that can do it. But other body fluids, like let's say sweat, shouldn't be able to transfer the virus as far as we know. So a simple mask, a cloth mask, will keep your fluids and secretions from your nose, mouth, to yourself. So, as far as sweat and other things, that shouldn't be a concern.
And now I'm about to ask you a question that affects a lot of people. It's their day-to-day lives. From Deidre. She shares her son and her are both essential workers. And she says, I don't have to work right now, but he does, and I'm very high risk. She says, we live together. What should we do to prevent passing COVID-19 to each other?
Yeah, and that's a concern. I think anyone that's having to work, I'm going to the office and I worry about bringing it home. And I think the best thing you can do is take all the precautions. Deidre's son should take all the precautions he can when he's at work. Try to avoid contact, masks if possible, the social distancing. And if she's really high risk, as hard as it's going to be, they should try to maintain social distance at home. If they can have separate bathrooms, if they can make sure they're not sharing, glasses, without washing them first, all that, just that keeping that distance is really going to help protect her.
And many people are honestly coming up with their own different concoctions to fight COVID-19 the best way they can, or at least boost their immune system. So Lacey's asking, do you recommend vitamin C, those concoctions with golden seal to fight off infection?
You know, there's no concrete data that the zinc, the vitamin C, the vitamin D, you know, is going to make any difference. I think if you're taking these in normal doses, normal prescribed doses, it's not going to hurt you, and maybe it will help. We just don't know.
And our final question, a viewer actually texted us, does the Red Cross have the ability to test blood donors for antibodies to use their plasma?
Yeah, and that's a really good question. And the answer is they're working on that right now. The FDA actually has asked the Red Cross to try to get people who've recovered from COVID-19 to get their plasma to use in people that are, you know, having severe complications. So yes, the Red Cross is looking for those people. If you're one of them, if you go to their website, there's a simple form to fill out that they can reach you. But Fran, I know we're probably running out of time, but there was a question that I got that I thought was really important about ACE inhibitor drugs, because there was a couple of very small studies that talked about these drugs possibly making it easier to get COVID-19. And I just want to say that do not stop your blood pressure ACE inhibitor or heart medicine ACE inhibitor drug. There's another study that says people that took ACE inhibitors may do better. But the bottom line is these studies are so small that nobody is saying change your blood pressure or stop your blood pressure or heart medicine at this point. Always talk to your doctor. And even for the viewer that asked about sarcoidosis, I think always call your doctor and ask if you're worried about something.
Clearing up that facts, not fear. Thank you so much, Dr. Sujatha Reddy. We continue to use you as our resident doctor. We really appreciate you answering these questions. We'll be right back.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Prime Time, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your.
Welcome back to the show, folks. Before we go, we always want to remember to see the light in trying times like these, and that's exactly what's happening all over the world. Take a look at this. A midnight light show brightening Wuhan's sky as a tribute to heroes in the battle against the coronavirus outbreak. That is gorgeous. It's the first post-lockdown day for the Chinese city after 11 weeks. And Disney doing its part to honor our nation's healthcare workers. Walt Disney World has lit up Cinderella's castle in blue. Oh, goodness, that's gorgeous. Staff members also spelled out thank you throughout the Orlando, Florida park to honor World Health Day. And thank you for joining us. We will be back tomorrow.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to